Uh, Hi everybody, good morning, good afternoon, and good evening for some of you. I would like to welcome you to the webinar, A Framework and Practical Guide on Linking Humanitarian Cash Transfers with Long-Term Social Safety Nets. This is a webinar based on a partnership of Oxford Policy Management and Cash Learning Partnership. So there we have two speakers and one discussant from both organizations who will be presenting to you today. My name is Alicia Spengler. I'm the project manager of the socialprotection.org and who's featuring this webinar. And I would like to shortly mention the speakers to you, and then I will hand over to Paula Hilbasan from CALP, who will introduce you to the web background and topics. So we are counting with Claire O'Brien, who is senior consultant at OPM, Nupur Creative from CaLP, and as I said, Paula, who will now give you a background and the topics of the webinar. Please enjoy the webinar.
So hello everyone, and thank you for joining. I'm just going to give you a quick overview of the webinar and the partners who are present. So for those of you who don't know about CaLP, the Cash Learning Partnership, it was formed 10 years ago with the purpose of knowledge sharing, networking, and coordination around the appropriate and timely use of cash transfer programming in humanitarian response. CaLP has evolved substantially throughout the years and is now a global network of more than 40 humanitarian actors engaged in policy, practice, and research within cash transfer programming. CaLP's members include UN agencies, the private sector, governments, and NGOs, and we also have a global community of practice, including over 150 organizations around the world and more than 5,000 individuals. For the Oxford Policy Management Group, it's a leading international development consultancy with more than 30 years of experience working in more than 100 countries. They have developed 9 permanent offices in Africa, Asia, and Europe, and have more than 200 full-time staff. OPM enables strategic decision makers to design and implement sustainable solutions for reducing social and economic disadvantage in low and middle income countries, providing analytical and practical support across the policy cycle. The work covers a wide range of policy areas, including climate change, economic development, education, health, water, public sector management, and social welfare. I'm just going to go ahead and give you a quick background and objectives for the webinar, and then we'll jump into the speakers. So over the past decade, social protection has emerged as an important social policy measure to tackle poverty and inequality in society and to address vulnerability to shocks. In line with these developments, there has been increasing interest in forging better links between humanitarian assistance and social protection systems in order to reduce the need for recurrent humanitarian assistance and to facilitate an effective response in time of crisis. However, social protection is still new to and not well understood by many humanitarian actors. While there are still a few social protection specialists also with substantial experience of humanitarian response. In March 2016, CaLP published, working with cash-based safety nets in humanitarian context, a guidance note for humanitarian practitioners, with the aim of helping to fill this knowledge gap between the two areas. It has been prepared from a humanitarian perspective for humanitarian actors engaged in cash-based programming, and it recognizes that social protection is a responsibility of national governments, but also that there is significant scope for humanitarian actors to play a role in strengthening existing and supporting the creation of new social protection systems where they do not exist or are underdeveloped. The framework for linking humanitarian cash and social safety nets used in the CaLP guidance note is based on OPM's recent working paper conceptualizing shock-responsive social protection, which form parts of OPM's ongoing study funded by DFID on the topic of shock-responsive social protection. CaLP is partnering with OPM in the study to support coordination and communication on the research at the regional level. Given these recent publications, the partnership that I talked about, and shared interest between practitioners, CaLP and OPM have put together this webinar with two main objectives. First, to increase the engagement with and the utilization of these resources that I've talked about by reaching a wider range of stakeholders, so all of you participating in the webinar right now. And second of all, to generate discussion between the humanitarian cash community and social protection so we can work more effectively with national governments and bridging the humanitarian development divide and identifying further opportunities for interface within these groups, in particular taking into account the whole momentum of change generated by the World Humanitarian Summit. So just to end this brief overview, this will be the first in a series of webinars over the coming years on the topics of social protection, shock responsiveness, and humanitarian cash transfer programming. Future webinars will draw on ongoing research and learning from OPM and CaLP, aiming to respond to the interests and concerns of the wider social protection and humanitarian cash communities of practice. So it's incredibly valuable that you're all here so that we can understand what your questions are, what your interests are, so that we can develop a kind of the future series of webinars. So having said that, I am going to hand over the mic to Claire, who's going to start with the presentations. Go ahead, Claire.
Thank you, Paula. Ricardo, the next slide, please. Thank you. As Paula mentioned, we have been working on a DFID-supported project on called shock-responsive social protection systems. And my colleagues and I have been spending quite a lot of time over the last year thinking about the links between humanitarian assistance in general, not only cash transfers, and long-term social protection. As you've all dialed in, this must be an area that seems pertinent to the countries that you work in. I guess that half of you may be practitioners and policymakers working in humanitarian assistance, and you may be wishing to know how you can integrate your interventions more closely with government systems. And the other half of you may be supporting longer-term development, and you might be considering how you and your partners can respond more flexibly to crises as they occur. So whichever side of this rather blurry divide between humanitarian actors and long-term development actors you sit on, I hope that you'll be able to go away after these 15 minutes with three things. Firstly is a common understanding of some of the areas of crossover between the two sectors, between humanitarian assistance and social protection. Second are some ideas about the ways that social protection systems can be used to respond to shocks. And the typology that we are going to present should hold true regardless of the state of maturity of social protection systems in the country that you work in, and also regardless of the extent of humanitarian crises, though the option that you choose would be dependent on the context. And finally, I'm going to leave you with some pointers to resources on this topic that you might like to follow up on later. So firstly, on the context, what's the issue that we're all trying to address here, and what are the objectives of the humanitarian and social protection communities? Well, it's commonly accepted that shocks and stresses are becoming increasingly frequent and significant, whether you count the frequency of climate-related shocks, the number of people affected by natural or man-made shocks, or the amount of money that is spent on resolving them. To give an example, in 2013, it's estimated that around 50 to 70 million people were supported with international humanitarian response, and that compares with 10 years earlier when it was about 30 to 40 million. And even though the last couple of years have seen unprecedented amounts of funding going to humanitarian aid, there are still considered to be quite some needs that have gone unmet. Now, shocks don't always lead to a crisis, but if they do, they can be costly, both in terms of the negative impact on development, on poverty, on human development, on malnutrition, and so on, but also in terms of financial cost. This is because the impact of these types of crises can last for years and years, either because the shock itself is protracted, one long shock like, for example, a civil conflict, or because countries experience the same shock cyclically year after year, maybe a drought or something that keeps coming back. And these days, as we see from reports like the annual Global Humanitarian Assistance Report, humanitarian actors are spending a lot of resources responding to these recurrent or long-term crises. So, for example, the 20 major recipients of humanitarian assistance in 2013 were also the same countries that had received most of the total in the previous decade. And there's plenty of other crises that are not high priority for international funding, but they've gone on for many years too. So this is why this question has arisen as to whether there are circumstances in which it would be more efficient to use a social protection system to provide some of this response. Next slide, please. So again, to continue our common understanding, let's think about what kinds of shocks we're talking about here. We're talking about covariate shocks, which are the ones that affect whole communities at once, rather than the type of shock that might affect one household at a time, such as the illness of a main earner in a household. Social protection actors will often also support those shocks that are called idiosyncratic shocks, but the main area of overlap is in terms of the covariate, the large-scale community shocks. Your shock might be physical, it might be an earthquake or a drought, so natural hazards. It might be social, like a civil conflict, for example. It can be political, like a coup, for example, or it might be an economic shock, like the big global financial crisis from a few years ago. Next point, please. So I mentioned that it doesn't always lead to a crisis. The previous slide, please. Could you go back to the previous slide, please? Thank you. I mentioned that a shock doesn't always lead to a crisis. So, for example, in the UK, it tends to snow for 1 or 2 days a year. About 5 centimeters of snow turns into a crisis. Transport stops. People find it hard to get to work, and so on. Whereas in another country that's better prepared, the shock doesn't appear as a crisis at all. The same is true for things like floods and earthquakes, where if you're in a situation of being better prepared, you reduce the severity of the crisis. So if we think of a crisis as being a shock that's accompanied by a situation of vulnerability for a certain part of the population, you can see exactly that there is areas of common interest between humanitarian and social protection actors. Because social protection actors are working to aim to improve resilience in order to reduce vulnerability, and humanitarian actors are also working to reduce the impact of crises in a similar manner. Next slide, please. So finally, just to wrap up the definitions and make sure we're all on the same page, I just wanted to clarify the definitions that we're using about humanitarian assistance and social protection, which if you work in one sector and not the other, you may be surprised that both are broader than you might expect. So for humanitarian assistance, the objectives of humanitarian action, as many of you know, are considered both to be to do with responding to disasters, so alleviating the difficulties and maintaining human dignity during and in the aftermath of man-made crises, natural disasters. But also there's an element of prevention and strengthening preparedness. And this is true for social protection as well. So next slide, please. You will see that under social protection we count a huge range of activities. If you're working in humanitarian assistance on humanitarian cash transfers, you may think that your main area of overlap is on long-term cash transfers. But you will see in the bottom left-hand box there that that's just one of many, many instruments that are used in regular social protection. There are instruments that are non-contributory, there are instruments that are contributory, like social insurance, where people pay regularly. Under social assistance, we have the transfers, the cash or in-kind transfers, but you also have public works programs. You may have fee waivers for basic health and education. You may even have subsidies that might be considered to be social protection. And all of these have ways of targeting people, of paying people, of doing monitoring and so on, that may all be valuable and have an entry point for you if you're a humanitarian actor trying to find a way of integrating with the social protection system. Next slide, please. So to conclude on the overlaps between social protection and humanitarian assistance, you can see that social protection interventions aim to reduce vulnerability to shocks, but they also respond to a crisis, and that the overlap is mainly about covariate shocks. And in trying to find this, the distinction between what counts as the shock or the crisis that is responded to by social protection actors versus humanitarian actors, a recent paper by Simon Levine and Kay Sharp that you may have seen that I referenced earlier concludes that a humanitarian crisis is essentially the crisis where the aid is funded by the humanitarian agencies. So there are great opportunities for collaboration because there are many areas of overlap. Next slide, please. So this is the second thing, having agreed to the definitions, the second thing I said we wanted to do was to identify a typology of a set of ways that social protection systems might be able to be used to respond to a humanitarian crisis. And we've identified 5 mechanisms. Some of them are mechanisms where the social protection actors take the lead and humanitarian assistance may be able to be integrated into it. Others are mechanisms whereby the humanitarian actors take the lead and gradually gear themselves towards integrating with an eventual social protection system. So let's look at these 5 examples. The first one is vertical expansion of a program. And by this we mean taking an existing social protection program that you already have and increasing the value or the duration of a benefit. So if you have a program like a long-term government cash transfer program, for example, let's say it has 100,000 beneficiaries, and perhaps there's a crisis, there might be flooding in the area, there might be a drought in the area. One option responding to the crisis is to say we'll keep our 100,000 beneficiaries and we'll give them a top-up, or we'll give them some extra support that they may need. A second option is what we call horizontal expansion. So under this circumstance, you may have a social protection system in your country which already deals with, to give the same example, maybe 100,000 beneficiaries. And in the event of a shock, you expand the number of beneficiaries to accommodate the people who are newly affected by a crisis. So it may be that if you already have a system that is looking after 100,000 beneficiaries, but the people who are doing the floods are in a different area, you may be able to expand the program to reach the people in the other area. the third example is that of piggybacking. And by this we mean you may want to take an existing program's infrastructure and if you're a humanitarian actor, you may want to design your own program, but you may want to use some of the elements of an existing structure. So for example, maybe a social protection system has a good targeting mechanism that you may wish to use. Maybe the payment mechanism works very effectively and you would like to use the same payment mechanism for your humanitarian cash transfer. So there are lots of elements that make up a social protection system that you may find useful to use that don't entail you simply to repeat exactly the same program. You don't have to give the same transfer or the same benefit or use the same people, but you might be able to use elements of a structure. The fourth way that social protection systems might be able and humanitarian response might be able to be integrated is what we call shadow alignment. And this is one that humanitarian actors might like to consider if there isn't really a social protection system that you can use. Perhaps it's not operating in the area that the crisis is in, or perhaps there is a major conflict and the government is not present at the moment. But it's worth thinking about whether you can set up a humanitarian response in a way that looks like or mirrors a real long-term government social protection system, so that in the event that it might be able to be taken on eventually, which may be a few years. So for example, when you set the transfer value, you may think, what is a transfer value that is feasible or sustainable in the long term if this was taken up by a social protection actor? And you may decide to set your transfer value at that. So that's aligning your separate humanitarian response with what a social protection system might look like. And the final way that a social protection system might respond to a shock is what we have called refocusing. And here we mean it may be decided if there are not extra resources, many of those other things require additional resources, but if there are not extra resources available, one option is that the program might decide to concentrate its resources on the most vulnerable people and from amongst its current beneficiaries. Sometimes this actively takes the form of what is often called austerity measures, in which actually the entire program is reduced. And if it's at that stage, then it might become a negative response. But it might be possible to refocus without reducing the total amount of resources, but by increasing the impact on those who are most needed. So this typology of the 5 ways that social protection systems might respond to a crisis is what Nupur is going to be picking up on in her presentation next, where we can look at the practicalities for humanitarian actors of deciding whether any of these options make sense in the context in which you work. Last slide, please. I'm just going to leave you here with a slide that has some resources that you can look at later if you're interested to find out more about these concepts, or also to think about how they might work in practice. The project that we're doing, the Shock Responsive Social Protection Systems project, is operating 6 case studies in Mali, Mozambique, Pakistan, the Philippines, Lesotho and Sahel. We've been going for about 1 year and there'll be another year to go. So do keep going back to the project website and check for new outputs from each of these countries. We hope also that in future webinars in this series we'll be able to provide you with some findings from those. We also have a series of working papers, of which I've just discussed the first one. There's a big literature review with concepts and examples as well. And we can also occasionally be found on Twitter if you would like to keep an eye out for us for updates. So thanks very much. I will hand over now back to Alicia.
Thank you very much, Claire. I would just shortly like to introduce tell you a little bit about Claire, because we didn't do that before she presented, and then introduce Nupur. So Claire is a senior consultant at OPM's Poverty and Social Protection team. She provides technical assistance to governments and international organizations on social protection, supporting policy design and monitoring, and evaluating program efficiency and effectiveness. She works particularly in Sub-Saharan Africa, Central Asia, and Eastern Europe. Claire is managing the DFID-funded 2-year global research program on shock response social protection systems, which you have seen in the presentation, the information they already gathered, which is exploring the factors that affect the ability of social protection systems to respond flexibly to emergency. She also leads OPM's independent routine monitoring of the Hunger Safety Net program in Kenya. I would now like to introduce you to Nupur, who is doing the next presentation on linking humanitarian CTPs with cash-based safety nets. Nupur is a social development and humanitarian professional with more than 25 years of experiences in program design and implementation, as well as policy formulation and influencing. She has held senior advisory positions with Save the Children, Oxfam, and UN World Food Programme on social protection and food security, covering East and South Asia, Middle East, Central Asia, and East-West Africa. She is also an expert on cash-based programming in humanitarian contexts, and on behalf of CaLP, led the drafting of Sphere standards on cash and voucher programming for the 2011 edition of the Sphere Handbook. Her more recent work includes the research for Oxfam titled Poverty, Inequality and Social Protection in Lebanon, and working with cash-based safety nets in humanitarian contexts, practical guidance for humanitarian practitioners for the Cash Learning Partnership. You can also find this last publication in the handout section, as well as the presentation itself and the working paper of the OPM research project. I would like to invite you also to already submit your questions, which we are going to sort out for the questions and answers session. And the questions which are not going to be answered during the webinar, they are going to be answered as a follow-up in an online space on the socialprotection.org, which you're going to be informed on. So I will hand over now to Nupur to do her presentation.
Thanks, Alicia. And just for the benefit of the audience, as Paula introduced in the beginning, CaLP has developed a set of guidance notes on linking humanitarian cash transfer programming with cash-based safety net. And this part of the presentation now focuses on the guidance notes. And thanks, Claire, for sharing the framework, because that's what I'm going to focus on now. So can we have the next slide, please, Ricardo? Okay, so just taking you back to what Claire was talking about, she talked about those 5 program options. And in this presentation now, I will focus on some of the practicalities of using those in our humanitarian program. So as you can see, the vertical scale-up and horizontal scale-up options are available in contexts where we have fairly strong social protection systems, or particularly strong social assistance systems, especially when we talk about linking them up better with cash transfer programs in a humanitarian context. So in that context, the leadership of the program has to be with the government, because social protection is the responsibility of the government. And but at the same time, there is a role for humanitarian actors, and that role is that of supporting the government. Actors in scaling up, whether it is vertically or whether it is horizontally. And some of the activities or tasks that humanitarian actors can embark on include transfer of resources to the government system, so that the humanitarian funds can be distributed to the beneficiaries of an existing system or through the system, or the delivery mechanism which is set up for social assistance in the country. The other way could be to strengthen the design. We all know that very often social protection systems are designed for addressing chronic poverty and vulnerability, which may not necessarily work very well with a humanitarian assistance program. So there might be some exclusion errors in the sense, or some groups that may be excluded from an existing list of beneficiaries within a government system. And that's where, again, humanitarian agencies can play a role in trying to influence the targeting. Then another issue here, particularly from a humanitarian actor's point of view, is the value of transfer. Very often we see that social assistance transfers are relatively small compared to the needs that emerge after a crisis, and the amount that is needed to meet those needs. And humanitarian actors who work in cash transfer programming are used to doing a lot of calculation to arrive at value transfer, which is based on calculations of the different, the range of needs of people who are affected by a crisis. And that's the value that humanitarian actors can add to a context where we are talking about a vertical or a horizontal scale-up of an existing social protection program. Again, humanitarian actors can play a big role also in looking at and strengthening the cash delivery mechanism. Now, often the cash delivery mechanisms for social systems are designed for a normal kind of a situation, whereas in a humanitarian context, the frequency of transfers is comparatively high. And that's where, again, humanitarian actors with their experience of working on cash programming can work with the government to help in strengthening the existing system so that it is able to scale up vertically and horizontally in times of crisis. And not to, and then, of course, I would like to underscore the fact that documentation and sharing of positive and good examples, not just among humanitarian actors, but also with other stakeholders who work on social protection, is extremely, extremely important. It's something which really came up while we were developing these guidelines. There's very little information and knowledge about how humanitarian actors have been working on social protection among people who work in the development sector. And likewise, you know, very often people in the humanitarian sector have very little idea of what is going on in the development sector on social protection. And we have this divide which we tend to maintain. And documentation certainly can help in bridging that gap. Then another option for humanitarian actors in scaling up vertically and horizontally is also to link up with the early warning systems that we all engage in, and linking up these social assistance systems in countries with the early warning systems so that they respond to triggers of crisis wherever the crisis is about to happen. Now, and particularly on the horizontal scale-up side, this is where the program would scale up horizontally to reach out to newer areas probably where there is no social protection system existing. And that's where clearly humanitarian agencies can play a very, very active role in by working with the government to help with targeting, registration, designing the program, and if possible, and if it is appropriate, even implementing it in some cases. Can we have the next slide, please? Thank you. So moving on, piggybacking, as Claire explained in her presentation, there could be an existing system, but we may find ourselves in a situation where this system doesn't necessarily match the needs of a humanitarian response. But there may be some elements of this system which could be used by humanitarian actors in responding to a humanitarian situation. So in these contexts, the role of humanitarian agencies or humanitarian actors could be that of a lead in designing and implementing a humanitarian response which uses some elements of the existing social assistance system. And this can be done in two ways. One is to use a beneficiary list, and there are a couple of examples which we will talk about later, where agencies have used the beneficiary list of an existing social assistance program to reach out to people who are affected by a crisis. This helps in reducing the time that is needed in targeting. So I'm not saying that this would be perfect targeting, but this does help in reducing the time taken to reach out to people and to help in saving lives immediately. Very often agencies who have used this mechanism tend to use the beneficiary list to reach out immediately, but at the same time they would do their own targeting to include people who are not a part of that beneficiary list into the system. So that's one way. The other way is to use the cash delivery mechanism. Now, humanitarian agencies who work on cash programming also invest a lot on preparedness activities when it comes to cash delivery mechanisms. And that's something which, by working with a system which already has a good cash delivery mechanism, humanitarian actors can work with that system to strengthen it, either through providing technical input to make it more agile, or to make it conducive for responding to a shock and in a way that it provides support to people on a more frequent basis. Now, moving on to the fourth option, that is shadow alignment. In this mechanism, we find very often we find ourselves in this situation where humanitarian actors end up responding in areas where year after year to recurrent crisis, and very often through cash-based programming. And we tend to call these as our seasonal safety nets or our cash-based safety nets. But these safety nets are not really owned by the government, and are not necessarily also, governments are not necessarily also involved in the design of this program. So a different way of doing this could be to lead in designing and implementing a humanitarian program that aligns with an existing program, maybe in the same country, in some other part of the country, so that in future, if the government plans to expand to the areas that are prone to recurrent crisis, it's easier for the programs, both the programs, to come together. As a starting point, I think the first thing is for agencies to first figure out what exists in the country. If there is a system already in place and not in the area which is affected by the crisis, then probably we might want to use the design of an existing program so that alignment in future is easy. But if that does not exist, in those contexts, this is an opportunity for humanitarian actors to lay the foundations of future social assistance program which is responsive to shocks. And that's a very clear opportunity, and therefore, while designing a program, this should be kept in mind, that whatever we design should be something which is sustainable and something which the governments can take up easily. And that would mean that some compromises may have to be made at some stage. And at the same time, the work of humanitarian actors does not end with the end of the humanitarian program here. It is very important for humanitarian actors to continue a dialogue and to keep engaging with relevant line ministries and departments in the government and other development stakeholders who are working on social protection to influence the design of the future social protection program. Repurposing, again, is something which is largely at the policy level, and therefore it is something which the governments must lead on, and the humanitarian actors play a supportive role and support the government wherever their support is requested. Now, apart from these 5 options, there is a 6th option as well. and it is not, all situations are not conducive for making the links between humanitarian programming and social assistance, especially in contexts where there is a strong chance of humanitarian principles being compromised. And in those kind of contexts, very clearly humanitarian actors must work on standalone humanitarian programs. Can I have the next slide, please? Ricardo, can I have the next slide? Thank you. Okay, there are a range of contexts where where humanitarian response and social assistance can be brought together. But for ease of understanding, in the guidance notes of CaLP, we've divided them into three broad contexts, starting with advanced, immediate, and basic. Advanced context is where the systems are well in place, they are strong, they're led by the state, and they have these systems have demonstrated their ability to scale up and scale back in response to a crisis, and they have evolved over a period of time. Intermediate is again very similar to advanced, but not as advanced, in the sense that they are led by the state. But these social assistance programs were designed for addressing chronic poverty and are not necessarily shock responsive. But they may have been tried in some context in some countries to deliver humanitarian assistance, and they are evolving to become more responsive to shocks. And then we have a third set of contexts, which is a basic context, where cash-based safety nets are designed by humanitarian actors, led by humanitarian actors, with a vision of eventually handing it over to the government or eventually influencing the design of an existing national social assistance system to make it more responsive to shocks. So these are the three contexts. Can I have the next slide, please? So whatever the context be, in all the contexts, the main purpose for humanitarian actors to engage with social protection will remain that of saving lives, alleviating suffering, and to maintain dignity during and in the aftermath of the crisis. This is the main aim and objective of humanitarian programming, and this should be the focus of all our engagement with social assistance. And the strategy, therefore, would be twofold. One is to strengthen an existing system if it exists, to strengthen it in such a way that it becomes responsive to shocks and is able to reach out to more people and reach out in a more timely manner. And the second is to lay the foundation of a strong social assistance system which is responsive to shocks in future. Next slide, please. I'll quickly run you through a decision tree. You can find it in the guidance note as well. We have decision trees like this for all the three contexts: basic, intermediate, and advanced. This particular decision tree is from the intermediate context, and just to run you through quickly. The starting point really in this kind of a context is to start with understanding whether there is a social assistance system in the disaster-affected areas. And if it does exist, then the next question that we would want to ask is there a significant overlap in intended beneficiaries of a humanitarian response? And if there is that kind of an overlap, then we might want to go a bit further to check whether the social assistance delivery system is able to deliver higher amounts and also in a timely manner, and is able to deliver it more frequently. If the answer to that is yes, then we might want to choose vertical expansion or vertical scale up. But if the answer is no to the first question, which is on social assistance, whether the social assistance systems exist, then we will want to check that is it possible to use the delivery system with new people in existing areas or in new areas. If the answer to that is yes, then we might choose the piggybacking option for the delivery mechanism. If the answer is no, then we might want to check. We might want to check. Sorry, I can't see the screen very well, so I'll have to look at my papers here. So yes, if the answer is no to this question about the possibility of using the existing delivery system in new areas or in existing areas with new people, then we might want to check if the context requires a long-term humanitarian presence. If the context requires long-term presence, if that area is prone to crisis, then we might want to choose again a piggybacking option on beneficiary list, or we might want to design a shadow aligned program which could be eventually taken up in the social protection system in future. But if that option does not exist, if there is no requirement for a long-term humanitarian presence, then it might be more appropriate for humanitarian agencies actors to choose a standalone humanitarian assistance program. Next slide, please. Can I have the next slide? All this sounds like very easy, but it is not. And on the screen now you will see some common challenges which I've tried to club as political, technical, and strategic. One of the biggest challenges that we face when we try and make these linkages is the lack of buy-in or a political will at times to forge the links. And we all know that the ministries that are responsible for humanitarian response and the ministries responsible for social protection are not usually the same ministries, and there are all kinds of dynamics, and that does play out when we talk about making the links between humanitarian assistance and social assistance. At times, senior level policymakers are willing to make the links, but we find that when it comes to implementation level at the village level or at the municipality level, the staff may not find it very appealing because it adds to their workload. Then there is this link, there's this risk of political capture, there is a very strong risk of compromising on the humanitarian principles, which is also a strategic challenge. On the technical side, there are some challenges which I've already spoken about earlier with regard to the targeting, mismatch of targeting and intervention areas sometimes. Sometimes the choice of cash transfer, the type of cash transfer does not necessarily work very well with the humanitarian response. The adequacy of the transfer is an issue sometimes. Coordination is a big issue because as we all know, in a humanitarian context, there are a lot of factors, the range of factors, the number of sectors is huge, and coordination within the humanitarian sector itself is a challenge. And here we're talking of coordinating with a completely different set of actors who may or may not have an understanding of the humanitarian context. And we're also talking of different layers of actors. So the coordination can be an extremely big challenge when it comes to linking humanitarian programming with social protection. Then sometimes the procedures that are designed for implementing a social system can be extremely heavy and may not be very agile for a humanitarian assistance program. That is a big challenge, and I've already said about the compromise of humanitarian principles, which can be a big strategic challenge. But another big challenge for humanitarian actors is the perception about humanitarian actors' role in social protection. It's a big bottleneck at times. It's not the perception of others, but sometimes it is our own perception as well on whether we have a role, whether we should do this, how will we be perceived, etc., whether we will be seen as impartial or partial. So there are all these challenges. Nevertheless, despite all these challenges, we do have some very positive examples. We have examples. Can I have the next slide, please, Ricardo? Can I have the next slide? Thank you. So we do have some positive examples, and the trend is growing, which is a very positive sign. So starting off with an example of vertical scale-up, we all know that in 2015, in April 2015, there was a big earthquake in Nepal, and UNICEF used the existing social assistance system, which was based, which used cash transfers to provide transfers to elderly, to children from Dalit households, to single women and women who are widowed, and people who are living with disabilities. So UNICEF had, even before the crisis, UNICEF had a very strong intent to strengthen the existing social assistance system, and therefore we chose the existing system to deliver humanitarian assistance by topping up the amount to all those who were in the beneficiary list of the social assistance program in the country. And by doing so, they were able to reach out to a large number of people, something like 434,000 people. At the same time that humanitarian agencies took to deliver a humanitarian response to a much smaller number of households in Nepal. So that's an example of a vertical expansion, and I would now invite Claire to talk about an example of horizontal scale-up. Claire?
Thank you, Nabor. As OPM is doing the monitoring and evaluation of the Hunger Safety Net program, I thought I would mention it here as a good example of horizontal expansion. I can just explain it in 1 minute or so and attempt to do some justice to it, but we perhaps in a future webinar might be able to devote a lot more time to discussing how it's working. The Hunger Safety Net program, which is co-funded by the government of Kenya and DFID, provides core routine cash transfers every 2 months to 100,000 households across the north of Kenya, which is a very arid area where they're prone to regular droughts. But when the registry for the most recent phase of the program was undertaken, the implementers attempted to enroll all 400,000 households who live in the north of Kenya. So all of them are registered, almost all have a bank account, and for the other 300,000 or so who are not part of the routine beneficiaries, their accounts just remain empty but ready. And if there is an occasion where there is a drought in a particular region, the money that can be transferred, that is normally transferred into the routine beneficiaries accounts, an equivalent value can be added to the account of any other person who's registered, who has a bank account, which can be done just as a one-off, or it can be done for 2 or 3 months. So this is a good example of a horizontal expansion in the event of an emergency, where people who don't normally receive the money, who are not considered to be the most vulnerable people in the region, might nonetheless be given 1 transfer, 2 transfers, maybe more, depending on need, if it is considered that their area is particularly suffering from a drought. So that's an example of a horizontal expansion.
Thanks, Claire. So quickly, in the interest of time, I'll quickly talk about 2 examples, one of piggybacking and the other of shadow alignment. In 2012, in Yemen, there was a big food crisis which affected a large part of the country. And at that time in the country there was something called as the Social Welfare Fund, which had a network in some of the areas that Oxfam was working in. So Oxfam used the beneficiary list of that system and also used the cash delivery mechanism to reach out to people who were affected by the food crisis. And in doing so, Oxfam did not limit itself to the beneficiary list that was provided by the SWF. They did their own targeting as well to reach out to those people who were affected by the crisis and were not a part of the beneficiary list. And once that transfer was done, there's the beneficiary list that beneficiaries who were not part of the social assistance program, that list was provided by Oxfam to the government to be included in the social assistance program. At the same time, the staff of Oxfam worked with the cash delivery mechanism, which is the post office in the case of Yemen, to help in strengthening the capacities to deliver frequently and at speed. Similarly, an example from Kenya, from the urban slum of Kenya, is an example of a shadow line program which was designed and implemented by Concern Worldwide and Oxfam with the government of Kenya. It started in 2009 as a response to the food crisis that had affected a large number of people in the country, but particularly people who were living in the urban slums, who had to buy a large part of their food from the market. So this program was designed in a way that it was a 2-year program of cash transfers and had an exit option for people once they reached a certain level. But the interesting part of this program was the decision to decide the value of the transfer. Now, working from a food security point of view, the value of transfer that the two agencies came up with was much higher compared to what they eventually ended up providing as a part of the program. And what they provided was, the transfer that they provided was similar to the social assistance that was being provided by the state in the country to other vulnerable groups. And the idea was that if the value of transfer is matched with an existing system, it will be easier for the government to take over the program at a later stage. And this did happen. The program now is completely run by, owned and run by the government of Kenya, and Concern and Oxfam provide technical support off and on to this program. So this is an example of shadow alignment, and over to Claire for an example of refocusing.
I think in the interest of time, I'm happy to keep going. So Paula would like to take back over, that's fine.
Okay. So if you want to find more details on the guidance, this is where you can find it. It's already there on the screen here in the handout. I would like to now call Paula, who can talk about the opportunities in the sector to make these things a bit more firmer, and if there are any opportunities within WHS down the corner. So over to you, Paula.
All right, thank you, Nupur. Can I get a slide, please? So I'm going to talk about, or Alicia, do you wanna do the introduction first?
It's okay, Paula. Go. Okay. So quickly, just to introduce Paula, she is advocacy coordinator at CaLP and has more than 12 years international experience in strategic planning, operations management, and the participative development of policy thinking in humanitarian and development context. She has operation experience in cash transfer programming with the ICRC and Save the Children, having conducted assessments, designed and managed responses, and led reviews and evaluations in Africa, Asia, Eastern Europe, Latin America, and Middle East. So she also conducted strategic research in the humanitarian effects of violence in Latin America and value for money analysis of cash and in-kind programming for Syrian refugees in Lebanon. Before joining CaLP, Paula co-facilitated the consultation and testing process for the core humanitarian standard and has also worked with parliamentarians in a number of Latin American countries to negotiate the adoption of international humanitarian laws and instruments. So thank you all for your very interesting questions and comments, and please go on submitting the questions. Paula is now shortly going to speak about a campaign of CaLP, a very important campaign of CaLP, and then we're going to the questions and answers sessions.
All right, thank you very much. Can I get the first slide, please? It's very interesting to hear from the technical side of things, all of the kind of the different kind of knowledge and areas of expertise between cash transfer programming and social protection that have so much potential for increasing the linkages. And I think that has been recognized globally, and in particular in a process like the World Humanitarian Summit, where there have been kind of many negotiations and many discussions about things that the world doesn't necessarily see eye to eye, but there is certainly one thing that everyone's in agreement, and that is that we need to get better at assisting people in need. In CaLP, we believe that big problems require equally big solutions, and the Agenda for Humanity, which is the framework for action that's come out of the World Humanitarian Summit, calls for that. It calls for big solutions. So we as CaLP have embraced this call and decided to contribute to the solution by focusing on a bottom-up collaboration and the power of the network. So we've launched an initiative called 100 Days of Cash to bring stakeholders together to facilitate innovative discussions about cash transfer programming, to produce a snapshot of what we need to fix in relation to cash transfer programming in this precise moment in time. So the content of these discussions have already been used to influence the Grand Bargain and other WHS discussions. And ultimately the purpose is to give suggestions to states and agencies that are part of the WHS process for meaningful commitments. Pledges that could actually change the way that we assist people in need through humanitarian cash transfer programming. So for the past 89 days, CaLP has been trying a big solution. We've been trying genuine bottom-up collaboration, a way to weave together and create strong alliances from the bottom up that get better leverage performance and results that no other single organization would be able to do. The discussions held during this process have been captured in a document called an Agenda for Cash, just to mirror the framework for accountability that is the Agenda for Humanity. It is a document that has been evolving organically with the WHS process, and CaLP has been the facilitator of this space. The content itself has been created by more than 40 organizations, including UN agencies, NGOs, donors, and the private sector. So this is not a document that has been created in consultation with implementers. It is a document created by implementers themselves. So the vision of the future that the Agenda for Cash presents is very well grounded in reality. A final version of the Agenda for Cash will be presented at the WHS on the side event CaLP is organizing with ODI and the Lebanon Cash Consortium. And the Agenda for Cash is a forward-looking document, and that will hopefully serve as a framework for action and, as I would say, mutual accountability to complement other mechanisms being created as a follow-up for the WHS. So I'm going to talk about the specific contents of the Agenda for Cash in relation to social protection. So as you can see from the first slide I've got up, the Agenda for Cash has 6 main areas. So the first area is around feasibility and understanding what are the actual requirements for use cash. The second area is around understanding and managing risk. So there are risks that are related to humanitarian assistance as a whole, and there are risks that are specifically related to cash. So it's important to understand what are the actual risks and what are risks of perception, and how can we ensure that that can be better managed. The third section is about people at the center. We all agree that delivering cash in a protection-sensitive manner requires consolidation of meaningful access and inclusion to ensure that the big element of cash around dignity and safety is maintained. The fourth one is localization and preparedness, and I won't spend a lot of time talking about it now because this is exactly where social protection sits, and we're going to talk about it later. The fifth one is about creating different relationships with the private sector. So it's not about just carrying on doing what we've been doing with the private sector. It's about creating relationships of shared value for both sides to improve the way we assist people in need. And finally, it's also around collective impact and coordination. The participants in the Agenda for Cash strongly believe that delivering cash at scale requires effective and efficient coordination between all cash stakeholders based on an understanding of collective impact, which speaks a lot to the way that this process has been driven as well. Can I get the next slide, please? Right, so as I was saying, the main home for social protection in the Agenda for Cash is in the area around localization preparedness. So what this talks about is about delivering cash at scale in a localized manner requires operational agencies, donors, and the private sector to be as local as possible, as international as necessary. And what does that mean? It means we need to build strong leadership and true local operational fiduciary capacity with the ultimate aim of reducing UN and INGO footprint and focusing on complementarity. This means reinforcing existing national and local mechanisms by investing in preparedness to deliver cash at scale, including by creating shock-responsive social safety net mechanisms as needed, and also increasing the necessary skills and capacities to deliver cash in an emergency. At a local level, this means directly funding local organizations to lead and own the implementation of cash at scale. So the way that the Agenda for Cash is drafted, we have put forward a couple of suggestions for commitments for organizations and states participating in the WHS. And if you look at the slide, there are two specific commitments in relation to strengthening the linkages between humanitarian cash transfer programming and social protection. The first that we're suggesting is for agencies to strengthen the linkages between humanitarian cash and social protection systems and practitioners, and defining the roles and accountabilities when working through social safety nets in humanitarian context. So this is about kind of sharing skills and bringing together practitioners so that they better understand each other and their language. But it's also about defining roles and accountabilities when safety nets will actually be used in humanitarian contexts. The second recommendation that we have in the Agenda for Cash is for states. And this is around encouraging them to commit to use existing social protection systems as a driver of speed and efficiency for emergency response when appropriate. To enable the integration of aid providers and linking cash transfer programming to existing welfare payment systems and beneficiary information prior to an emergency. So this is a call for states to use the systems that they have locally to make sure that they're able to be used during an emergency. Can I have the next slide, please? So where does this all fit? Because this is the call from practitioners to, hey, we need to fix something, we need to do something. These are some model commitments, but where does in the world of WHS does this fit? And the WHS is quite a complicated kind of puzzle, but it mainly revolves around 7 high-level roundtables. And one of these high-level roundtables is around changing people's lives. And it's about the humanitarian and the aid system in general. And it has a core commitment, number 1, to commit to a new way of working. And below that, it has the call to transcend the humanitarian and development divide. So there's quite a lot of space for agencies and states in particular to take all these recommendations seriously and make meaningful commitments. Can I have the next slide, please? So as part of this push, we're suggesting 2 model commitments to make. So one is for organizations, another one is for member states, and it's based on not only on the content of the Agenda for Cash, but also on the wording of the WHS sample commitments as well. And I don't know how many of you in the webinar today have kind of the ability to share this within your organizations, but it would be incredibly valuable, again, to use the power of the technical people in the field implementing these programs to say, hey, this would be meaningful change. If you want to commit to something that will actually change the way we support people in need, this could be it. Can I have the next slide, please? In response to that, CaLP is also committing to doing lots of things. So we're committing that by 2019, we will support states and humanitarian and development actors to establish effective operational partnerships through the development of platforms, guidance, and pilots to improve and strengthen the synergy between cash transfer programming in the humanitarian sector and social protection systems. So we are already starting to do that. CaLP has an incredibly interesting technical advisory group from our membership, and there's one particular working group focused on building those linkages with social protection. So the guidance that Nupur was talking about is part of that effort, but we're hoping to build more platforms to have more work, and we're currently, for example, exploring how we can better work with SPEACB and all the fantastic work they're doing. Can I get the next one, please? So in reality, if you would ask me, oh, but the WHS, what is the WHS going to change? It's not going to change anything. I'd say, you're right, the WHS is not going to change anything. It's the people that are participating in the WHS that will make a change. And it's about the questions that people have raised during the process and actually the work that's going to happen afterwards that's incredibly valuable. So after the WHS, there's a mechanism that is being designed to follow up on pledges. And we in CaLP feel the true value of the 100 Days Initiative is actually being able to bring some content to this work. And we strongly believe that whatever this mechanism looks like, it should be based on the power of the collective of humanitarian and development cash implementers and have a very strong sense of independence. CaLP members believe there's a natural role for CaLP in this because of the membership and all the linkages that we have. I'm going to stop there because we have a lot of very interesting questions. Nupur and Claire, can I ask you to come back with your webcam, please? Right, so we have lots of interesting questions, and as Alice was saying before, the questions that we don't manage to answer now will certainly kind of follow up in kind of a platform that she'll kind of let you know how it works. So the first question we have is very interesting. So it says, given that Claire says that the government might be absent in certain cases and Nupur says the responsibility for social protection lies with the government, can one of you guys perhaps elaborate a bit on the interaction that takes place between these two actors in an emergency situation? So this question is around fragile context, right? What do we do when the person or the entity who's responsible for it either has very rudimentary systems or they don't exist anymore at all? So does any of you want to take a stab at this?
Sure, I can respond, Paula. Thank you for the question. It's a very interesting point that we've been looking into when we've been examining some of our case studies for our research. The area, if there's a situation in which the government is not present and the humanitarian agency wishes to deliver a cash transfer, there's a couple of reasons. One of them might be the kind of most extreme situation of like a Somalia style crisis where the government is largely absent. And in that context, in Somalia a few years ago, when there was the major famine, the humanitarian agencies working in the region got together and did what we might consider to be a shadow-aligned social protection system, in which they coordinated amongst themselves to develop a system that had some common features like common targeting mechanisms and common post-distribution monitoring of their cash and so on, to set up systems so even though the government was absent, the intention was that over time it is something that could become more substantial and long-term as a social protection mechanism. The other option might be that the government may not be entirely absent, but they may simply be absent, or their programs, the social protection programs, might be absent from the region where the humanitarian crisis occurs. So, for example, in a situation like Mali, which has had a cash transfer program, a routine cash transfer program for the last 2 or 3 years, the program is in the south, but the recent conflict has more affected the north. And in that context, again, you could imagine a shadow-aligned system whereby the agencies who are thinking of introducing humanitarian cash transfers in the north are looking at the system in the south, considering things like what is the cash transfer value, how often do people get the money, what is the targeting, and so on, and can consider which elements of that they might want to include, so that eventually, as the government's program expands, it might be able to consider whether to take something like that on. So that shadow-aligned version is mainly the area where if the government does not have a program but you're looking for something you can use, that might be an option.
Okay, great. Thank you, Claire. We have another super interesting question. So the question is around context where the relief effort is normally led by a national disaster management agency with smaller international aid. And they're giving the example of Latin American and the Caribbean. So could the tips and the toolkit for linking humanitarian assistance with social safety nets be used by government disaster management agencies as well? I think this is one for you, Nupur.
Can you repeat that, please? I'm trying to figure out where it is.
Yeah, so in contexts like Latin America or the Caribbean, where normally the relief effort is largely led by national disaster management agencies with small international aid, do you think that the toolkit could be used by government disaster management agencies?
Yeah, sure. Because as I explained during the presentation, we're talking of 3 different contexts. We're talking of advanced, intermediate, and basic. Depending on the type of social protection system that exists in those countries, the guidance groups can be used by anybody, whether they are from the government or from humanitarian agencies. They can be used by anyone. And there are detailed guidelines for different contexts. For each of these 3 contexts, there are detailed guidelines.
Okay, very interesting. One more question. Do you think the theoretical framework applies to advanced contexts where the relief effort is normally sorry, I'm reading the same question. Yes. To your knowledge, are there examples of social protection systems with horizontal scale-up to include refugees or migrants?
Yes. I don't know very many, but certainly one I can talk about, and that's Gaza. And those of you know Gaza also know that it is a very specific context. So in Gaza there are a large number of refugees. There is a social protection strategy which was developed in partnership with humanitarian agencies and with the other agencies in the country, and led by the Ministry of Social Affairs. And small part of that social protection strategy is includes providing food vouchers to refugees, and it's a part of the strategy and a part of the program there in Gaza. And WFP runs that program with Oxfam. And during the war in Gaza in 2014, in July 2014, that voucher system was used to expand horizontally to include new people who were not a part of the system earlier. Not only was it used to expand horizontally, it was also used to expand vertically. These WFP electronic vouchers were used to deliver assistance that was provided by UNICEF and also by CaLP, if I'm not mistaken. So it provided the top-up, and it also was used to reach out to people who were newly affected by the virus. So that is an example, but then again, Gaza is a very, very different context. Other than that, I don't know of any program. I'm sure there may be some, but there are not very many examples of social protection programs that include refugees, because there's a lot of discussion about social protection being the responsibility of the state towards whether it is towards the citizens or whether it is towards the residents, and that's been quite a debatable issue. And because refugees, when if they're not in the country, then very often do not qualify to access some of these social protection programs.
Right, thank you for.
Sorry.
Oh, sorry, Claire, go ahead.
The question also asked about migrants as well as refugees, and there some of the experience of northern Kenya might be relevant because although they don't have displaced people in the sense of people internally displaced by conflict, the program is designed to cater for nomadic pastoralists. And so the same principles of how do you reach people who are moving around, there could be some interesting lessons there that might apply to other contexts, particularly in terms of flexibility of making sure that people can pick up their money wherever they happen to be. Experiences like that might be useful for internally displaced people as well.
Right, thank you very much. We have a couple of participants that have their hand up. So what I'm going to do is give you the floor. So Celine Felix, I know you have your hand up, so I will unmute your microphone if you have a question. Please go ahead, Celine. No, not working. Okay. We have another hand up from Maze. Maze, I'm going to unmute your microphone if you want to make a question.
Hello. Hello?
Yeah, we can hear you.
Hello. Yes, this is Maisy Badawi from UNICEF Jordan. I just want to add a comment on the question on providing cash transfers for refugees, that we have in UNICEF Jordan a child cash grant at the transfer program for Syrian refugees in Jordan that provides unconditional grants for families with children in school age. So this is a program that is particularly for refugees, Syrian refugees in Jordan.
Okay. Alice, maybe do you want to wrap up because we're running out of time?
we still have more than 100 attendees. If anybody else wants to really say, contribute with something, I see that there are still 3 people with a raised hand. We can open to them if you are up to that.
We've gone through the 3 of them and it doesn't work. So I guess maybe, yeah. And it's 2 minutes till the end of the webinar, so I was wondering if you want to wrap up.
Yeah. There is no problem to stay on online longer, no, if people are still interested. But anyway, we can now end the webinar, but I would like to thank you all for your excellent presentation, Claire, Nupur, and Paula. We received a lot of questions, and we are going to send these questions, collect these questions and send them over to the presenters, and they are going to be answered, and they are going to be posted on the socialprotection.org platform in a dedicated online space for this topic. And we are going to inform all of you where you can find the answers to the questions in the coming 2 weeks. You can also find the recorded webinar and all the publications and the presentation itself in on the socialprotection.org platform. Please have a look there and join if you are not yet a member, because we are also going to maintain you informed about the next webinars in this series. So once again, thank you to all the panelists and to the participants. We had a record of attendees for this webinar with more than 160 people online at the same time. So probably more than 180 people altogether participating. So we see that there is a great interest in this topic and a lot of open questions and things to discuss still, and we are going to go on doing that. Thank you.
Thank you.
Thank you.